By December 15th, Governor Cuomo says Pfizer will begin its first batch of deliveries for its vaccine. 170,000 are expected to go into distribution for New York State alone, followed by another 170,000. That is the second dose needed for the same group within a 21-day period. Close behind, the governor says, is Moderna's vaccine, though how many will be in supply, still unknown.
On the vaccines, my goal for this state is to have the fastest, most effective vaccination program in the United States.
What is known is how the state is prioritizing who receives the vaccine first. Approximately 85,000 nursing home patients and another estimated 130,000 of its staff. Congregant long-term facilities, then about 600,000 healthcare workers across the state. Simple math will show you that's far more than the 170,000 allotment, though state health officials believe Moderna's vaccine will fill that gap. Pushing healthcare workers down on the priority list today did come as a surprise for some.
The recommendations from the federal agencies, which have been working on this, is to prioritize healthcare workers. And the reason is that we need to shore up the medical system, which is at risk of being overwhelmed.
The council's health committee will meet Friday to further streamline and discuss vaccine distribution plans more locally across all 5 boroughs.
We want to focus in our hearing on Friday on the question of how we're going to prioritize and also questions of equity, and to make sure we don't repeat the same mistakes that again and again have been made throughout this pandemic.
Statewide infection rates still rise. Overall, New York State is at 4.6%. Hospitalization rates also increasing everywhere. More than 1,200 in New York City are hospitalized, a number that's doubled in the last 3 weeks. Infection rates in the city are 4.8%. We did ask Mayor Bill de Blasio today about 2 communities in particular with alarming numbers in recent days. Breezy Point at 12% and Gravesend Homecrest in Brooklyn at 9.9%.
I share your concern, Narmeen. We're seeing different things in different places for sure. I am concerned that there's some messages have gone out there about not wearing masks, and I think that's dangerous.
The mayor says targeted efforts to get the public to wear masks continues, especially in those high-risk areas, and that means working with local groups to get the word out. Furthermore, on the state level, PSA campaigns to get people to stop having small gatherings at their homes also rolling out today. In Midtown, Narmeen Chaudhry, Pix 11 News.